how do benzos help with mast cell activation? And can benzos help with small fiber neuropathy? I have CVID, could not go to sub-Q IG without serious high blood pressure and complex migraines and neuropathy. Also, relapsing polychondritis, past exposures to pesticide, petroleum, out in the country to avoid so many exposures, can only take limited therapy. I'm going to answer this in part two, an interview that I had with the patient yesterday. She lives 2 hours away. She has to wear dark sunglasses, super dark. She can't tolerate light at all. She had a doctor tell her who thought she might have celiac disease. She had done some really great progress in her underlying mast cell symptoms by going gluten-free. They told her to start eating gluten like crazy, and then we'll do a biopsy. Well, she did, and then she couldn't stand any light, severe photophobia, and basically for another reason, she was put on low-dose benzos, Ativan, and then she could see. But literally all day long, she had to be in a totally dark room. So if you look at the literature, there are like 3 studies of mice and cells, and basically you treat them, and you get the mast cells, and you treat the cells with benzos, and they stop putting out histamine. So benzos are big in my practice. I would say that in general, 90% of my patients do well with the simple steps and kindness talked about with antihistamines and flavonoids, vitamins, and of course LDN for many, and that's 60% of my practice. But I will use benzos liberally in patients who are living a horrible life and they get better. And we're going to be doing a study about that sooner than later, sending out a questionnaire talking about benzos, neuropsychiatric issues, LDN, comparing that to spouse controls.